involves management of osteochondral defect, osteochondral defect with innovative and tailored approach and recent advances. So let us know what is osteochondral defect. Osteochondral defects usually involves damage to both cartilage and underlying subchondral bone. These defects can lead to joint instability, pain, and eventually osteoarthritis if left untreated. By managing these defects, we can prevent further complications and joint function. So usually causes includes trauma, repetitive stress, like chronic overuse of the joint, osteoarthritis dissecans, genetic factors, and sometimes developmental anomalies also. And risk factors include age. It is especially prevalent in adolescent, young adults with high physical activity like athletes, and with the joint anatomy, like abnormal anatomy of the joint, and previous injuries. Contributing factors can be overweight that lead to increased stress on the weight-bearing joints, hormonal imbalance affecting bone density and cartilage health, and third is nutritional deficiency. That is also important, lack of essential nutrients like vitamin D and calcium. So let us discuss clinical considerations. We all know that patient evaluation usually starts with detailed history, physical examination in standard fashion, we all know, and diagnostic imaging like X-ray, MRI, CT scan, and are very crucial in getting detailed information about the defect. Here arthroscopy allows direct visualization, and it is very important for management part also. So let us discuss about the planning for the osteochondral defects. So what is important? When we are, it is very important to know about the defect. So its size, patient factors, and other things. When we have to deal with a small comminuted defect, then conservative management can be sufficient. If we have to deal with a middle size to large fragment, then fixation is needed. Conservative management usually involves pain medications like NSAIDs for pain relief, physical therapy focusing on the extending the muscle around the joint, and activity modification to reduce the stress on the articular surface. So what are the options for surgical management if we have to deal with middle size to large fragment? So these are there are so many options, but today we will be discussing about the fragment preserving suture bridge technique. So other options are microfracture technique. It usually stimulates the formation of new cartilage by recruiting the mesenchymal stem cells at the cartilage defect site. Other is osteochondral autologous graft transfer. What happens here? We harvest and transplant healthy cartilage and bone from non-weight-bearing area to defect site. Other is mosaicplasty. It involves multiple small osteochondral grafts. Third is autologous chondrocyte implantation. Here we use cultured chondrocytes to implant at the defect site. Another is matrix-induced autologous chondrocyte implantation. It is similar, but here we are also using scaffold-based versions of frameworks. Other is osteochondral allograft transplantation. Here we will use the graft from allograft. Osteochondral implants are also available. And last is osteochondral fracture fixation using pins, screws, headless screws. So our focus is on the fragment preserving suture technique. It is actually a video demonstration of our innovative technique. So here we have the two techniques with a similar kind of purpose, but it is published by two different scientists. So how to clear this?
No.
So in this video we will be demonstrating about the fixation of osteochondral defect using a innovative and tailored approach. Here you can see there is a loose fragment almost attaching to the PCL attachment side, and you can see it is clipping into the joint. That can cause locking of the joint. Here we will fix it with Knotless osteocare 5.5 mm peak anchor and suture, vicryl suture actually. In this we can see that we are inserting a 5.5 mm osteocare knotless anchor with the vicryl at one side. With the help of these vicryls, and probe, we will reduce the osteochondral fragment. Before that, we have to make micro punctures to enhance the healing. We are doing micro punctures, micro fractures. We know that bone marrow has the growth factors that enhance the healing. Now we are reducing that osteochondral fragment with probe temporarily. In that 5.5 mm osteocare anchor, we are using 3 to 4 strands of vicryl suture. After reduction, we pull over these vicryl strands in fan-shaped fashion, and we will secure these strands with the knotless push-lock anchors on other edge of the defect. We can see we have inserted first strand of the vicryl in lower side. Like this, we will insert 2 to 3 more push-lock anchors. We can see that fragment has been reduced well. After this, we can debride these faded edges of the defect also. After inserting 2 push-lock anchors, the fragment is now stable. But to avoid slippage and failure of the fixation, it is better to use at least 3 to 4 strands of the vicryl with push-lock anchor. Now we can see it is done almost. Fixed well, and it is robust and stable fixation. So these are the steps we have already discussed in the video. So what is the benefits of vicryl suture bridge technique for OCD fixation? So we can see it minimizes the articular cartilage damage by avoiding penetration. Second, provides robust and stable fixation. And it reduces the need for hardware removal due to bioabsorbable sutures. In case we use implants like screws, pins, then we have to remove later. So that will be another surgery for the same thing. Allows early range of motion and faster rehabilitation. This is another case study using the similar kind of technique but in different fashion. We have used that vicryl sutures in fan-shaped fashion, but in this study they are using in triangular fashion and at 3 different points of fixation. So now let us discuss indications and contraindication. It is very crucial to have a right indication for this procedure. So usually we have already discussed that it is indicated in adolescents. It is more prevalent in adolescent, young adults with high physical activity. And in osteochondral fractures of like femoral condyle, trochlea, patellar cartilage defect, and osteochondritis dissecans also. And usually we have to fix with this by middle-sized defects and large fragments only. Contraindications: if patient has degenerative joint disease, chronic cartilage fragments, and small accumulated defects, and completely detached non-viable OCD cartilage defect, then it is totally contraindicated in this case. So pulse and benefits. So we have to use at least 3 to 4 strands of vicryl suture between each knotless anchor. This creates a tab with a broader surface area to compress without cutting through the cartilage. We have to plan suture configuration to optimize the surface area of the compression on the fracture fragment. We have to do it before starting the fixation. Another, take care to clean and prepare both the fragment site and donor bed to optimize the anatomic reduction and healing. Pitfalls are like loss of reduction of patellar lesion may occur during knot time. Other is insufficient number of suture and suture configuration may lead to loss of reduction. Like if we have less than 3 sutures, then it is high risk of failure. Do not overtension the vicryl suture during anchor placement, although unlikely it could cut through a thin fragment. So now we can discuss recent advances and techniques. So usually recent advances includes biologic augmentations like TRP, bone marrow concentrate and stem cell therapy, gene therapy. 3D printing custom implants are also available. These provides a framework for growth factors and stem cells to attach and proliferate there. Synthetic scaffolds are also available. We are discussing these biologic implants, platelet, plasma, and bone marrow concentrate. Stem cells, we have discussed mesenchymal stem cells have the potential to differentiate into chondrocytes, the cells responsible for cartilage formation. Synthetic scaffolds, it can be biphasic, triphasic, and now 3D printed scaffolds are also available. What is the benefit? 3D printed scaffolds can be tailored to match the exact geometry of the osteochondral defect. This technology allows for precise repair and integration with the surrounding tissue. Gene therapy we have already. By gene therapy, it involves altering gene expression to promote cartilage repair and reduce inflammation. Early studies have shown promising results using gene therapy. Actually, what happens by delivering genes that encodes for growth factor and anti-inflammatory proteins, gene therapy has the potential to significantly improve the outcome of the osteochondral defect treatment. Conclusion. In conclusion, early diagnosis and personalized treatments are key to managing the osteochondral defects. Actually, combining the traditional method with innovative modern techniques like biologic augmentation, synthetic scaffolds can significantly improve the outcome. Thank you.